PCOS or polycystic ovary syndrome is one of the most common problems which is encountered by women of the reproductive age group. Along with problems in just bearing a child, it may be associated with long-term health risks in women also. Thus, today we have this session today to discuss all about PCOS and its impact on long-term health. And for this session, we have a senior gynecologist, Dr. Krishnaveni Nayini, today with us, who's a consultant at Ankura Hospital for Women and Children. Ma'am, besides being a specialist in obstetrics and gynecology, she's also a fellow member of the Obstetrics and Gynecology Society of UK. She's also worked there for 12 long years and obtained her CT, which is completion of certificate of training in the UK. She's also accredited with the British Colposcopic Society. It's an honor to have you with us today, ma'am, to discuss this important topic. A very warm good afternoon and welcome to you.
Thank you, Vandita, and good afternoon to all our audience as well. Okay, so shall we start?
Sure, ma'am. So to begin with the session, ma'am, I think we'll first put up a very basic question, which every woman would want to know, which is, what is basically a polycystic ovary syndrome?
Okay, so the polycystic ovarian syndrome is a very, very common condition. And when I see some of the ladies in my clinic, when they are told you have polycystic ovaries, they will really get frightened. Just by this session, I would like to reassure them that is the reason, the basic idea of why we should do this talk. And this is a condition where it can affect women's periods, or it could affect her fertility, or it could affect her appearance, how she looks. And also it can affect her long-term health. And this is because of a little bit of a hormonal imbalance that happens in her body, because she has got the polycystic ovaries, which release a bit more hormone than the normal woman. And obviously, this condition is very common, as I was saying, and especially in the Asian women, the incidence of it is around 25 to 30%. So almost like every 4 women that walks into our clinic, we can see that one of the women will have the PCOS. But obviously, taking all the precautionary steps and the appropriate treatment, we can have a very good treatment for this condition.
Ma'am, so is there something specifically like the polycystic ovaries? Will they be different from the normal ovaries?
That's a really good question, Vandita. So the polycystic ovaries, like normal ovaries, when you do the scan, and when we take the measurements, it's like they measure around like less than 10 centimeter cube. But when woman has this polycystic ovaries, they can measure more than 10 to 11 centimeter cube. And also in the ovaries, we have what is known as follicles, that is like a fluid-filled spaces where the egg develops for the future ovulation. And the women who have this polycystic ovaries will have double the number of these follicles. Usually they will have like less than 12 in each ovary, the follicles. But the women who have the polycystic ovaries, they will have more than 12. And obviously this causes the hormonal imbalance. And obviously, again, many people will have like a question like, if they have polycystic ovaries on the scan, are they definitely going to have the polycystic ovarian syndrome? The answer is no. If some people may have just the polycystic ovaries, but because they're maintaining good diet, exercise, they are not expressing that condition. So it is not necessary that the women who have the polycystic ovaries on the scan should have polycystic ovarian syndrome.
Okay. Ma'am, so what symptoms will such a woman face? How can she identify that maybe I have a problem and I should visit my gynecologist?
Okay, so the women who have this polycystic ovarian syndrome, they can present with irregular periods. So they may not get a period every month. So they may get a period once in 2 to 3 months, or sometimes they may not get a period for even a year also. We do see sometimes. And also when they start with the period, they may have the bleeding for 15 to 20 days or more than that. Or sometimes they can present to us with the fertility issues because they have very irregular periods and they're not able to ovulate every month. They're not able to attain the pregnancy. And also sometimes they can present with like excessive body hair that will be on the upper lip, chin, on the chest, on the tummy, and on the back, hair, like on the buttocks, arms. And also sometimes they can, because they're overweight, because these women sometimes because of the hormones, they put on a lot of weight, and they can present to us with the overweight. And sometimes because of all these problems that can affect their appearance, how they look. And because of that, they have symptoms of depression and psychological issues. And in the long term, some of them can have like drowsiness during the daytime because the depression, they're not able to sleep during the night. They can have a little bit of snoring. All these problems they can present to us.
Right. So, ma'am, is it present in a woman ever since she's born? Is it to be there when she grows up to be in her childbearing age group, or are there any specific factors which are acquired that causes a polycystic ovary syndrome?
Okay. So it sometimes runs in the families. So if you have an aunt or your mother or your sister, somebody in your family had the polycystic ovaries, your chance of having the polycystic ovaries almost raises up to 50%. And obviously, they're not born with the polycystic ovarian syndrome. And obviously, as the age advances, the expression of this symptoms become more. And obviously, not all women will have the clinical symptoms either. It is because if they are maintaining their diet, exercise, they tend to have regular periods, they tend to have like normal pregnancies, and they will not have any long-term problems. So the expression of the situation differs depending upon their lifestyle.
Right. Right. So, ma'am, if someone comes to you with a PCOS problem, then how can it be diagnosed?
Okay, so we usually take 3 criteria. One of them is the periods. If they're irregular, that is one of the criteria. Or if they have like the excessive body hair, that's what I was talking to you. Or we do some of the hormone tests like the FSH, follicle stimulating hormone, LH, and the testosterone levels. So if the hormone profile is abnormal, or if they have the polycystic ovaries on the scan. So among all this, they should have at least 2 features. Then only we classify them as having polycystic ovarian syndrome.
Okay. Ma'am, so PCOS and its long-term implications on health. So how is it related? Can it have any long-term implications, or will all of them have?
Yes, it does have long-term effect. So especially if the woman has the polycystic ovaries, then when they get pregnant, they tend to have the diabetes during the pregnancy, and what we call it as gestational diabetes. And so what we do is, if they have the history of polycystic ovaries, we tend to screen them in the early part of the pregnancy, around 24 weeks, to see whether this woman having diabetes or not. And otherwise, sometimes these people can develop the diabetes later on in the like when they reach 40s, especially. And hence, if they have history of polycystic ovaries, they should have regular blood sugar checks from the age of 40, at least once a year, to see whether they have the diabetes problem. And also, because of the overweight, they tend to become hypertensive because of the overweight. There is a lot of left strain on the heart, basically, left ventricular enlargement, what we call it as, and that can lead to the hypertension problems. And sometimes it's like if the woman doesn't have a bleed once in every 3 to 4 months, what happens is the lining becomes thicker and thicker. And then it becomes like what is known as hyperplasia. And then that changes into a cancer later on. So the women who have the PCOS, we always advise them if they have no period for more than 3 to 4 months, they have to consult the gynecologist and they should have a scan done. And the scan, if suppose the lining of the womb is more than 10 millimeter, then we advise them to have the medication to have the lining shed off so that they don't get more prone for this endometrial cancer. And obviously, taking all these precautions will reduce their chances of having the cancer. And also, if they have irregular periods later on after they complete their family, we tend to give them a treatment with the Mirena coil, that is like a hormone releasing coil that will actually prevents this thickening of the lining of the womb, and that reduces their chances of endometrial cancer.
Right.
Yeah, sorry, you want to
no,
have
no,
a
no, no, you
yeah.
can.
Also, we were discussing about like psychological issues because they are overweight, and because of that, they get the depression, psychological issues. This is again one of the long-term effect these women are going to face.
Right. So, ma'am, besides what I told from the medical side to them to reduce these long-term complications, is this something that they can do from their side also in order to reduce these complications
Definitely,
or problems?
their willpower and motivation is what required. So that we always refer them to the dietitian, because sometimes we think that we are taking the proper diet. I'm not taking anything. I'm just taking 3 meals. But what our Asian diet, especially our South Indian diet, consisting of morning starting with idli dosa, and or atukulu, burugulu, something will start off, then afternoon rice and night rice. So this is something that increases our chances of having diabetes and these symptoms of this PCOS to become worse. So from their side, if they have certain dietary precautions, like they have to take the less carbohydrate diet, and they have to take more protein rich diet, so they can take more pulses, lot of vegetables, lot of fruits, and also oats, because brown rice they can take it, and the products prepared from the wheat, and this all will reduce their chances of having this PCOS and their weight. And also other important factor is the exercise. Basically, if you want to lose weight, what we need to do, it's like if you want to just maintain your health, you will do the exercise like at least 30 minutes every alternate day to keep your general health going on well. But if you want to lose weight, you have to do the exercise at least 60 to 90 minutes per day. And also this exercise should involve like vigorous exercise. Basically, they have to sweat, and that could be in the form of brisk walking, skipping, or they can do the cross trainer, treadmill. So they can go to the gym. So by doing the exercise, what happens? The problem with the PCOS women is they have more belly fat, that is the visceral fat. So sometimes you may see the whole body is very thin, but they have a big tummy. And that is the more dangerous thing. And so we go with what is known as the body mass index. So if their body mass index is more than 30, the risks are more. But obviously, the recent thing that we are taking into account is the waist circumference. So if their waist circumference is less than 80 centimeters, then their chances of having these long-term problems, hypertension, diabetes, all these are low. And once it crosses more than 87 centimeter, then their chances of having the problems with the PCOS will increase. And hence it is very important they have to do some abdominal exercises to reduce the fat in the belly. And obviously, like if they lose at least 10% of their weight, they lose 30% of this visceral fat. So that is the reason the exercise and the diet is the most important treatment for the woman with the PCOS rather than any medications.
Right. So, ma'am, while you were talking this, I was just wondering, like, if someone's not taking care of or is not able to take care of the lifestyle factors, then will it also worsen the PCOS? Because if
Yes,
I'm not too
definitely.
aware, right? So
Yes.
if I'm not able to say bear a child because of PCOS, if I'm having some problems of periods, and I'm getting more stressed by it. So meanwhile, probably in my body, my PCOS is also worsening.
Yes, that is like a vicious cycle,
Vicious cycle.
actually.
Yes.
Like they get depressed, they are not able to lose weight, and the PCOS gets worse. So we have to break that chain
Right.
at some point.
So that
And
is where
they
to
will
get
always,
aware. It's so
yeah,
important to get aware that what's happening and then to probably intervene from our side.
they always claim because of PCOS, my weight is more, but
Yes.
it's other way around.
Other
It's
way around
just with,
also.
yes,
Yes, yes. So I'm sure women listening to this will take care of it and probably take a charge of their own health now.
sure, sure.
So, ma'am, is there a cure also, like any metabolic disorder? It's just maintained on.
Yeah. As we talked about, the diet and exercise plays an important role. And again, there is no definitive cure for this polycystic ovarian syndrome. It depends upon what symptoms they are having. Suppose if they are having irregular periods, and if they're not having a period for 3 to 4 months, then we give the progesterone medication for about 5 to 7 days to have the bleeding. And if they are having like a fertility issues, then we give the medications for them, like what we call it as ovulation induction. And that will help them to release the egg every month, and thereby that increases their chances of having a baby. And sometimes they do not respond to that, then we go for little bit higher treatments like IUI, that is like intrauterine insemination along with ovulation induction, or the IVF, that is the test tube baby, or sometimes we do what is known as laparoscopy and ovarian drilling. So here is the procedure when the medications are not affecting her and they're not helping her to release the egg despite of giving the medications. Then we go for this procedure where we take a small needle, and it is like a heated up needle, and with that we make a small holes in the ovaries, thereby this polycystic ovarian syndrome gets corrected. Okay, and also it depends upon, as we talked about, if they have any psychological issues, then we tend to refer them to the psychiatrist, depending upon, means basically they need counseling basically, rather than any uh, any intervention, active intervention. Suppose if they are having like excessive body hair, and again, the first things what we try is like they can do the bleaching, waxing, and sometimes they can go for the laser treatment or electrolysis. And sometimes we have the newer treatments like eflorelthin, that is a cream that we use it for removing the extra hair. And so we also use the medications also to reduce this excessive hair called spironolactone, or oral contraceptive pills to reduce these symptoms. But the hyperandrogenic symptoms, that is the ones which are excessive hair, they tend to respond late. They take around 6 to 9 months at least after you start the treatment to respond. Okay, so these are some of the treatments which we use. And obviously, there is no permanent cure as such. The permanent cure is your diet and exercise.
Right, right. Women, on behalf of the women who have PCOS, if I can ask you, they may be worried that if I have PCOS and if I'm conceiving with difficulty, then will my child be all right? Like, will they have any immediate effects once they are born?
Actually, once they conceive, there is no much difference. But obviously, as we said, they slightly have increased risk of miscarriage. So what we usually do is, before, sometimes they do not ovulate with even the ovulation induction drugs, then we give the drug called as metformin that helps to reduce the insulin levels in their body. And together, it helps to reduce their blood sugars and also helps with the ovulation. And we stop the drug once they conceive, and usually the babies tend not to have any of the problems or long-term effects. Only thing is the gestational diabetes, which we were talking about. So they are more prone to have that problem, and that's why we actually screen them at around 24 weeks to see whether they have that condition. If they do not have, they don't have any other problems at all, and the babies themselves will not have any problems.
Right, ma'am. As you've practiced for so many years PCOS in India and also abroad. So any final words for a woman with PCOS, your advice from you?
Okay. So what I would say is do not get scared. And it's like sometimes I see the woman really shivering in the clinic and they think it's almost like cancer. And obviously they are so depressed, and do not get worried. And it's a very common problem and easily treatable. And obviously it's your role is do the diet and exercise, and you will be back to normal and you will be like any other woman. So do not worry about this condition. But obviously, if you have this problem, just take some precautions, like just as we said, in order to prevent diabetes, have like yearly screening of blood sugar levels once you reach your 40s. And if you don't get a period once in 3 to 4 months, please see your gynecologist and take their advice. And obviously, if you have been diagnosed with hypertension, then take the medication. Lots of time what we see is patients wants to become better without the medication. So they want to try without anything. So that's good to some extent, but when things are not going good, they have to take the medications.
Right. Thank you so much, ma'am. I'm sure many women would be motivated and they must have benefited from this fruitful session by you today. And thank you so much for your time. And to all the women who are listening to this probably now or who will continue to watch this video later on, you can always post your doubts or queries in the comment section and we'll probably get back to you with the answers. Thank you, Ankura Hospital for Women and Children, for organizing. And thank you once again, ma'am.
Thank you, Vandita. Thank you very much for hosting. Thank you.
So much.